guys, this is Denise again with Baby Go Home Care, and today we have a special addition to our channel that we are going to introduce. Kelsey, this is my daughter-in-law, and she is due in the first week of May, and so I thought it'd be a good idea to do a video on what to bring to the hospital and things to help you at home. So stay tuned. Okay, so the first thing I put together is a basket for Kelsey to take and put in her bathroom. You're looking at, what's all of this stuff? It's so much easier to have everything ready by the toilet because you're not moving around, and honestly, to move around is uncomfortable. So I will tell you, so this is pretty much for a vaginal delivery because that's what we're hoping for. And I will talk to you in just a minute about a C-section and things to bring. So what we have here is a variety of pads. We got our thick ones, our medium ones, and our thin ones. You're going to have a period for about 2 weeks on again, off again of a cycle. If you're breastfeeding, it will be lighter, and so you may need to do the panty liners. If you are bottle feeding, you're going to notice more cramping and being more uncomfortable. So also in here is our lovely, what I call our Victoria's Secret underwear. These are those mist underwear that they give you at the hospital that everybody loves. The reason why we like them so much is because they are breathable. They have a lot of air. So if you are going to want to bring some underwear, make sure they're cotton. Silk is not very comfortable and it doesn't breathe to help the stitches heal. So if we're a vaginal birth, your doctor should or probably will prescribe Dermaplast spray. Dermaplast spray is an antibacterial spray that has lidocaine as well as to prevent infection. And so we usually give these to our ladies as well. So this is that lovely peri bottle that everybody talks about, and what you want to do is you want to put 1 or 2 squirts of antibacterial soap and some warm water, and you would clean your bottom, the front and the back, and this helps to prevent infection as well because you don't really want to wipe, so you would pat dry. Okay, so when you go home, this is Epsom salt. This is wonderful to rest in. So it's time to take a bath. I recommend if you have an episiotomy, you do at least 2 baths a day. You think that's, wow, that's a lot. It's actually to help you heal. Heat causes dilation, which causes circulation. So you can just put a ½ cup of Epsom salt, let it dissolve completely. Some people even recommend putting a towel down to sit on it and make it more comfortable. You raise the bath water all the way up because if you're breastfeeding, heat dilates, and I would raise that water all the way up, get your breast nice and soft, then lower it halfway down. You're still sitting in the water. Tell your husband or mama or whoever bringing the baby, breastfeed at that same time because the heat dilates and that milk's coming in, and you're doing 2 things at once. You're kind of playtime with him, you're sitting in there, you're also taking your bath, as what you call your Sitz Bath, and you're bonding with your baby. So this is a good thing to do. So I would recommend twice a day. Also, when you get out of the bath, you want to take a hair dryer. And if you have a diffuser, that would be great. If you don't have a diffuser, you can just attach a pillowcase with a rubber band around it, what I tell moms to do. And you would lay down on your recliner or a chair or bed, put a beach towel down, and you put your legs up and put the hair dryer between your legs in a low setting. It will help you allow those stitches to dissolve faster. It takes about 2 weeks, and that's my 2-week rule. It takes about 2 weeks for those stitches to dissolve to start feeling better. So if you can do that, that will be great. Also, when you get out of the shower, just take your hair dryer for about 30 seconds and dry on the back side. That helps too. Also, when you do the Dermaplast spray, you want to go from the back side. It's almost impossible to go from the front. So try to go on the back side, okay? So the other thing in my little here is my goodie bag, and you probably may have some, is I recommend stool softeners if you have a episiotomy or a laceration until you start having bowel movements that feel okay to you, because your first bowel movement, I will tell you, sometimes feels like your baby's coming without the epidural, and it hurts a lot. So stool softeners, anything over the counter is usually okay. It's what your doctor's already recommended. But definitely, once again, you want to check with your doctor first. The other one is a trick that I tell moms to do, is that these are eye makeup pads. And what I tell moms to do is put some of these into a container. You can get a Walmart container, Tupperware, and you want to put some in here, probably about 5 or 10, and then I want you to put some called witch hazel. So these are like your make-up Tux pads, but what I want you to do is I want you to stick them in the refrigerator, have them already made. They can stay nice and cold. You can have some in the bathroom and some in the refrigerator, and since everything's all wet down there anyways, you just take witch hazel, helps everything kind of constrict, especially if you have hemorrhoids, and there's a good chance you probably will if you had to push for a good period of time. So this will help everything kind of shrink and dry, and it's also safe for your episiotomy. It actually help that as well. So these are like a little cocktail that I recommend people using. If for some reason we have to do a C-section, we would not use the baths, we wouldn't use the Dermoplast spray. We can use the Peri bottle and the soap just to clean, because you would pat dry and then your stool softeners. Your incision will be at your tummy, and this might be wet and sticky. So along with your underwear here, you can actually put a panty liner, a thin coat just so things don't stick to it, and it allows it to air. Now, if you're asleep, you're going to have lots of milk and sweat and stuff like that, and you don't want to get that area infected. So I would change this out the same as much as you would change out your pads, and this will kind of keep that area air dried and nothing sticking to it. If a trick, if you are having a C-section or had to have a C-section, 2 things. One is when you sit and stand, let me get a chair. So when you sit and stand, whether you're getting in your car to go home, you're going to the bathroom, or you're just getting out of the bed, I want you to blow out. If you blow out, you don't tense those muscles up, and it makes it easier to stand because you're not tightening those muscles that they just cut, so it hurts. So when you stand up, you're going to blow out. Just like if somebody's going to give you a shot, you blow out so it doesn't hurt. As well as, somebody's going to get in a car wreck, you tense up because it hurts. And it's going to hurt, but the person driving, let's say they're intoxicated, they're fine because they were relaxed. So if you blow out, this will be less painful. Also, when you are home in your bathroom, if you can, and beside your bed, I would bring a high chair, a high back chair like your dining room chair. So one, you can put all of your products for your bottom on the chair in the bathroom and your toilet paper and everything, and use that chair to push up, because it hurts to go sitting to a standing position without using any support, because at the hospital you have those rails and at home you don't. So the same thing at your bed, it's really hard to get in and out of your bed. So put a chair, high back chair behind your bed, and use that to push up, and it'll make it a lot easier while you're blowing out.
Well guys, that ends the end of part 1 on what you need to have at home for mommies and recovery after birth. Stay tuned for the next videos on what to bring to the hospital, as well as having a baby basket with everything you need for breastfeeding. So until then, stay tuned, good luck, and remember, you've got this.